Professor Shafi Ahmed, thank you very much for joining us here for the Happy Smart City podcast. It's an absolute honor to have you. I know you're very busy, and so it's a pleasure to have you. If we may, I'd like to proceed with the first question. And the question is, what is your current occupation?
So thank you so much for the invitation. So good to be here. So I have a number of roles. So my main role is that I've been a colorectal cancer surgeon for the last 20 years or so, and I work at the Royal London Hospital. But I have other roles in education and innovation and technology. I work with Vodafone as their current ambassador for 5G and connected health, as well as working with the Abu Dhabi government as the advisor to their, their vision around digital transformation. And I'm also a teacher. I'm Associate Dean of the Medical School and teach at various universities around the same theme of digital transformation, innovation, and entrepreneurship.
So, it was very easy for me to decide that I had to reach out to you. Personally, my mom, we lost my mother due to cancer. And education and technology are also things that are very close to my heart. So again, thank you very much. So how does your profession contribute to the economies of cities?
Well, look, if you look at my role as a clinician at the front line, and obviously we've been busy over the last 11 months with a pandemic, but in terms of the work that I do in terms of cancer, it's one of course, the most important diseases that contribute to death around the world. And of course, a lot of illness is from that as well. So I guess from our perspectives, how do you, as a city, manage a healthcare system where cancer becomes one of the most important parts of that vision? How do you create a system where people get equitable healthcare? They get access to the right people in the cancer pathway. It could be, for example, surgery, it could be chemotherapy or even radiotherapy. So actually it becomes a fundamental part of building an infrastructure of a smart city, ensure the health and well-being of the population at large is well managed. And cancer is universal, of course. I go around the world and I've been to about 30 countries over the last 3 or 4 years, working with governments, colleges, universities around the kind of having conversations around the future of training, education, also the provision of resources for healthcare as a whole and cancer in particular. So of course, at the moment I work do some humanitarian work in Gaza, in Palestine, which is a difficult place to get to. In the last 6 years, we've been working on training methods for their surgeons locally, building support infrastructure, for a sustainable solution, and now we're doing the cancer work with them. So I guess as a medical professional, healthcare is so important to how cities are run in the future and to manage the well-being and health of the population.
Fantastic. And I imagine that solving cancer at a large scale also speaks to other non-communicable diseases. Is that correct?
I think it's the same kind of principles. I think the principles are quite straightforward. First of all, is how do you use resources appropriately? And everyone has, of course, a lack of resources in healthcare. The other, of course, is how do you prevent the illness? How do you screen for cancer, similar to other diseases? How do you prevent people from going into hospital or having complications? How do you cure more people? And so the emphasis really in healthcare is moving away from sick care to what we call well care, to manage people when they're well, which is much more cost effective, of course, helps them in their lives. So I think we are moving to a different kind of healthcare system. And of course, this is where the current technology innovation and the kind of the interest in transformation has been so rapid, particularly the last 11 months during the pandemic.
And next question is, what elements do you think are lacking for your vision of accessible healthcare?
So I think going back to the pandemic, which is obviously quite relevant, we've seen that we really are a global community. And actually what's coming through is how do we work, I guess, more together across the globe, creating global visions, global solutions for a global community. So that's where I think we're heading towards. What's lacking? Of course, it's the political fallout from these things, the national interests, rather than a universal appeal for healthcare. There's a lot to learn from, say, the Western countries, but also a lot to learn from the third world countries or lower middle income countries about how they're managing large populations with healthcare needs. So I think there has to be like this two-way conversation. People call it reverse engineering or reverse innovation. It's not really, it's innovation across the whole world. If you go to parts of Africa, for example, where we have mobile money, where we're seeing how the adoption very quickly has leapfrogged other Western countries. At the same time, the Western healthcare systems does afford standards, etc., that might be influenced across the globe. So the question is, how do you get these pockets of innovation that happen around the world? How do you get the governments that are leading this transition, bring them together to find what the best fit is for different populations? So I think really the lacking bit is the kind of the joined up thinking across the globe. Even in individual countries, say, for example, the UK, we have the NHS, which is an amazing healthcare system. But again, it's disparate. We have different parts of NHS, like NHS Digital, NHS X, Health Education England, NHS England, many kind of parts to this jigsaw that are still disparate. How do we bring it all together to assume to have a uniform access to healthcare? So the best learning practices are gathered very quickly and disseminated throughout the healthcare system. So I think one is around data. One is around capturing that data on a global level, and then using that to ensure that actually what we're learning is best case scenarios, using resources better, and sharing common knowledge and common experiences. And I think that's what I've learned from the pandemic. And that's a good thing. Although the pandemic has been desperate, it's been sad, of course, with the affliction of many people around the world. Actually, it's also for us a springboard. It can accelerate the change for us. It's brought people together in ways that we can possibly imagine. So I'm optimistic. I think the learnings from the last 10 months and where we need to be, I think, are coalescing and converging much more than they were before.
Right, right. And I see some parallels in this answer, because there has to be some type of standard and regular issuing of public data. But of course, to the extent of which this data is published is something for another conversation. But what I have seen though is also in finance, people use these Bloomberg terminals, and most of Western Europe and some countries in Asia and perhaps Oceania have very standard information about the economy and the financial system put out on these Bloomberg terminals. But regions like Africa, it's a lot more tedious to have what someone may call, basic information. And I can agree that public data is the last frontier. Now, how are machine learning and IoT, the Internet of Things, improving the lifecycle management of a patient from end to end?
That's a really good question. So one of the things I would say, first of all, we have a whole host of technologies coming together at the same point of human existence. It's like an inflection point for humanity. Let's think about this. We have, of course, AI and deep machine learning, as you've suggested. We have the 5G mobile networks being set up. We have nanotechnology, immersive technology. We have kind of this quantum and cloud computing. We have wearable sensors, remote monitoring. So actually what it is, we've got a whole spectrum of technologies that are coming together. The question for us is, how do they work in conjunction? They're not isolated. How do they provide this better care or more personalized care for our patients? How do they improve the quality? And to talk more in technological point of view, how do they improve the user experience and the user interface? Because at the moment we're failing, and so we need to reimagine healthcare. So let's take the examples you've given me, AI and machine learning. We've seen already that we're seeing use cases for the first time that are kind of measurable and useful. For example, diagnostics like imaging, CT scans, chest x-rays, ultrasound, etc. Looking at retinal scans of the eye or indeed skin lesions. All these things that have image plays are showing effectiveness with machine learning, will allow more people to be diagnosed much more quickly, using resources much better, and using the staff around them, medical staff, to do their job appropriately. It'll automate and improve, it'll support the work of doctors around the world. So I talk about AI machine learning as the kind of the hope, the hype, and now the reality. We've had the hype, all the promises were made a few years ago. We've seen the hope that it could really challenge and change the way we think about healthcare, improve the outcomes, and now we're seeing the reality. We're seeing in 2021 and 2020 real use cases. In UK, for example, during the COVID pandemic, we saw we saw the use of CT scans using AI to predict the outcome of COVID disease, looking at images, for example. So real amazing technology. The Internet of Things, of course, is very important. And this is where all these technologies I was describing earlier come together. And so they're all connected. So as we go forward, what does that look like? First of all, we mentioned data already, and data will flow freely across the healthcare system. Also, of course, patients are now being monitored more remotely. So, example in the UK, because we're not having face-to-face consultations anymore, we moved to telemedicine kind of video platforms. Patients that suffer with chronic diseases, things like diabetes or asthma, COPD, etc., are now being managed in different ways, at home, at their convenience. And we're seeing the use of sensors, remote monitors, for example, for diabetics and others, so they can measure their own data and send it to their clinician. So we're seeing a transition from secondary care into primary care in a seamless approach. And more care now in the future will be available in primary care or social care, connecting all their, whether it's connecting their devices, connecting their, their electronic health record. So there's work to be done. And obviously one of my roles I have is I work with Vodafone, a big, of course, telecom company that has a big footprint in Africa. And I'm their kind of ambassador for 5G and connected health. And I see 5G as the kind of, what I call it scientifically as the covalent bond. It's a bit that holds all these things together because of its fast bandwidth and low latency. So it's kind of this, yes, so that's kind of that's why I think it's holding it together. We needed that missing piece of the jigsaw. And maybe we have that going forward to connect all these devices with lots of data in the future. So it's exciting. I think the patients are demanding change and they're also responsive to change. Yeah. Who would have thought a year ago would have been breaking bad news on a telephone or indeed telemedicine platform? Now it's routine to break bad news, see patients remotely. So the kind of doctor-patient relationship has now evolved and will allow these kind of technologies to play their part in reinventing healthcare.
Okay. So now we're going into a little transition question here that'll be focusing a bit more on public health and government systems as far as health is concerned. So how will machine learning and IoT improve public health information systems? And would you say that governments are taking full advantage at this point? I know we're still in the path to 5G, but given what the frontier is for us right now, are governments taking full advantage?
So at the moment, we're going through a voyage of discovery. It's an unknown entity going forward, which is exciting. But also it can be intimidating for not just governments, but patients and healthcare workers alike. I think governments are thinking differently now. If you look at the strategies of many governments around the world, it's based around a digital economy, a digital platforms. It's moving towards this whole concept of passing digital knowledge throughout their population. So the public are getting ready now for this kind of transformation. Of course, as they do that, they have to build in the data play, as we mentioned earlier, to ensure that public health can be managed very quickly, flexibly, nimbly, and in real time, using real-time data analytics. Obviously, that varies across the globe. One of the things we found to do is capture good, clean data at the point of origin. And that's what needs to change. We need to say, let's collect as much information as possible in the right way with the ethics, ensure that we have confidentiality, and we ensure that there's security, of course, which is another conversation for another day. But as long as we adhere to those principles, collect information, and then look at the entire life of a patient. It's not about their healthcare. It's about their use of social media. It's their mobility, their movements across the country. It's using all the information around them to build a modern public health information system. And human beings are complex now. We have access to many, many more technologies. We are more visible through various platforms, of course. How do you use all that information now to create more, I guess, sophisticated public health awareness campaigns, but also public health policies that allow for this new modern way of the way that we live in the current world. And that, of course, goes into the smart cities, connecting the transportation, the the communication tools, and also healthcare. They're almost becoming embedded together and almost converging, as I said before, at this point of inflection for humanity.
You know, every time a conversation gets or hints towards a singularity, I'm just always, you know, my senses are heightened as to what extent um, a citizen is actually voting, um, or if the algorithms are just reinforcing themselves, because when you've got these cloud platforms that share the same data and use the same type of machine learning principles, um, people will get information from different sources, seemingly different sources, in order to make a decision, to vote for government policies. But these are decisions that could be coming, um, from the algorithms, as opposed to real human evaluation of the utility and long-term sustainability. It just boggles my mind every time, and I think that's one of the biggest questions that I ask myself every time. But certainly, policy and machine learning, there's a lot of synergies there. Um, but the extent to which the vote of the citizen will reign supreme in the long term is the biggest question to me. Um, Now, on to the next one. Are there any health hazards that smart cities may pose to the public health system? So, for example, increased heat in the city due to a proliferation of electronic devices and machines. Obviously, when we have all these machines, there'll be a bit more heat in the cities. So, are there any health complications that perhaps local governments should be aware of, or at least try to think of, or at least a framework of assessing, if not specific hazards?
No, that's a really good question. And of course, as we move to more smart cities, it's a priority and obligation to manage risk um, as we go forward. And I'm sure governments, as part of their policy, will look at those areas. So you're absolutely right. As we have, say, more technology, more devices, there's a few issues that may arise. Of course, talk about climate change and the heat generated and use of electricity or use of batteries or whatever. That obviously has an impact on the natural evolution of I guess, energy. That we need to look at in the kind of context of the climate as a whole and how people are using that kind of those energies. Secondly, of course, we look at people have talked about these kind of risks of 5G and other technologies that might cause radiation. And all of that has to be, it's more risk about misinformation that needs to be really carefully aligned by the government so that we have good, accurate information out there rather than this world of misinformation around what possibilities could be. The of course, obvious thing about health hazards when you decide to go down this data-driven pathway is cybersecurity. If you go back about 3 years ago, at our hospital at Royal London, we were affected by the WannaCry Trojan horse, which came and affected our whole system and locked us down for about 3 months. We had to go back to paper records for about 3 or 4 months because of the fact that this Trojan had taken over the entire healthcare system for us. Now, this is a big hospital in London, so this can happen. Have we taken a precaution around that to make sure that its patient data is kept confidential? Do we have that conversation with the various stakeholders to ensure that we have policies to ensure companies who provide healthcare support externally adhere to the guidelines? Do we ourselves define that role? So I think one of the roles that we do have with all this, of course, is that we, I guess, the masters of our own universe. Technology is great, it's good. This whole concept of smart cities and technology is great, but we've got to make sure we define it very carefully. Of course, we want to move at pace. We want to innovate rapidly. We want to translate some of these ideas very quickly to benefit the society as a whole. At the same time, we have to have a certain degree of caution and do full risk mitigation as we go forward. I think there's a tenuous balance between driving hard very quickly, writing policies, at the same time, the balance between the risk associated with that. I'll take that example, for example, looking at smart cars, the driverless cars. I will use that example for healthcare because important, understandings of where healthcare might be heading towards. Say, take a Tesla car now. You drive, it's driverless. It has great, of course, it may improve the accident rate, less deaths, for example, which is happening already because it's just much more reliable in that sense. Then, of course, the battery part of the cars. What does that take? What's the energy around that? Also, if things go wrong, for example, if things go wrong with technology, so the car has an accident, who's liable? Is it the driver? Is it the driver who's not driving? Is it the car itself? Is it software? Is it Tesla, a major company? So it's understanding that future landscape, the risk that might evolve. And I look at other industries for healthcare to help us frame our own kind of conversations around what that could look like. And that will, of course, enable policy to be written appropriately.
I agree 100%. And, the issue of self-driving cars, and electric cars for that matter, is another big one for me because it has so many loopholes for the principal agent problem, where, we just don't know if we will be accusing the car, or at least the company that built the software that controls the car. And if we blame the human being, I mean, how do we even decide what type of assessment do we put in place to determine whether it was indeed the human being or the vehicle, and what's the error rate, and is the error rate acceptable, and should we accept any error at all? I mean, it's just one of those things. But again, I mean, speaking to the proliferation of electronic devices and even electric vehicles, I agree with you when you talk about a balancing act across applications and policy, because one other thing that comes to mind for me is there's going to be, I mean, far more electronic devices once 5G hits, simply because, there can be upload and download speeds that are just phenomenal. And everyone will just be using sensors for everything just to improve the quality of life or efficiency in business. But to me, apart from the heat generation, it also presents the hazard. Presents the hazard of greenhouse gas emissions, because at the end of the day, people may argue that that self-driving, that electric cars, don't use fossil fuels. But if you track the value chain, or at least the supply chain, they're consuming electricity, or at least being recharged by electricity that was generated from coal-powered, power plants. So those are things that I think may require a bit of in-depth analysis, and there might be just a bit of sleight of hand from the marketers. Now, the last question from me is, what elements of smart cities should local governments focus on to improve quality of life in cities? So in general, I mean, what for you is most exciting as far as quality of life and utility for the citizen?
That's a great question. Let's go back to what you were saying earlier about this kind of balancing act of kind of technologies. And you've seen the kind of recent press in the last few weeks where the Bitcoin has gone through the roof in terms of its price point, right? We've seen it. At the same point, people talk about it making it easier, more secure over many, many years, using both Bitcoin and kind of, I guess, blockchain technology. At the same point, I was reading yesterday that someone who uses Bitcoin regularly has an energy bill of $600 per month because the mining is so expensive, using lots of computer power. So there's the kind of always a balancing act.
Yes.
Trying to move on, but balancing the effects, the side effects, the untoward kind of risks that come out of these ideas. So it's that kind of concept as we're both discussing. In terms of your question around what they should focus on, in terms of health, I think we're moving to, as I said before earlier in the podcast, from sick care to well care. And now really it's about maintaining people's well-being, people's quality of life needs to improve. The pandemic has shown us we're now working more flexibly, more at home, more with families, away from offices. That's got to change. They've got to think about actually if we're moving the workforce into home, giving them more flexible approaches, because we're not going to go back to more like before, then do we need as much office space, many buildings in cities? Do we actually move a lot of that home, improve the quality of the connectivity, which we mentioned earlier, allow them to use high speed bandwidth for video calls or whatever, connecting people, etc. So that's one thing. I mentioned the resources need to be moved to the community because it's about managing people's health better, chronic diseases, whether it's their just mental health well-being, whatever it is. We almost need a shift of change, of not push all the resources to secondary care, pushing it to really prevention, well-being, and primary care. A lot of governments around the world, a lot of countries don't have effective primary care. In fact, it's non-existent in many parts of the world. It's run by this hierarchical method of care, from secondary care driving the healthcare system. And that model isn't working. We're going to change that. I think the other thing about thinking about is people's transportation to work, wherever. What's a clean living look like? How do we clean the air, have better climate, have better ways of working together? Outside environments, you invest more as a smart city in terms of the environment that we're in, so you can have exercise, which will maintain your well-being, maintain health. So we have those. We don't enforce that because we build cities on top of each other, throwing many people together as close as possible. So you get these mega cities almost. And that doesn't really doesn't improve people's health, of course, because of the fumes from the cars, or indeed the lack of space, etc. So how do you design something that's more attractive? And one of the things I would say to the audience to go look at, I guess just out of concept, it's NEOM. That's spelled N-E-O-M. It's this vision of Saudi Arabia's 2030 vision around a future smart city. And it's a huge area they're going to transform, supposedly, with a huge smart city, planning this whole concept we're discussing in real time. Transportation, it's schooling, it's education, it's the healthcare system. It's all trying to think what we talk about now and how that could be proposed in the future. So I say to everyone, have a look at that more as a stimulation exercise to understand what are people thinking about for the future of smart cities. But I think those are the areas I think the government public health need to address probably at the beginning.
Lovely, lovely. And this also speaks to something that's been on my mind for the longest time, is how big is a big city? I mean, how big can we go? Because I think there's so much happening right now that I mean, could help us break away from the pollution and the congestion. For one, if you think about technologies like Hyperloop, the sheer speed that people can move from different regions within a country or even cross border, the speeds are amazing. And I think that urban and regional planning, or at least urban and regional planning, has to evolve somehow. There has to be a new standard. Because quite frankly, I think the prospect of megacities, or at least gigacities, we never really thought about it. I think we've only thought about it from an efficiency perspective, that when you can cram a lot into a small space, some exciting things will start to happen and a lot of productivity would take place, i.e. GDP per hour. But there's certainly a lot of things that we need to consider. And another one that I may have left out, and I see we still have a bit of time, so please allow me to ask this question. You said that you were working with Vodafone, and I think I saw online that Vodafone had some conversations with Starlink, the satellite company. And to me, this speaks to the African conversation. Because for the longest time, we've still had cell towers, which can only cover, they're only efficient in flat topographies. But once you start going into the rural areas of Africa, which are very mountainous, it's very expensive to use cell towers for internet connectivity. And so the advent of consumer internet services via satellites is something that is really profound. And once you put 5G into the mix, then you can start sending larger packets of data per second or per minute. And if you think about Africa, you know, the cities are very small compared to the outskirts and the rural population distributions. Um, so to me, it kind of seems like the real Africa hasn't been seen, and it can only really awake after these satellite constellations are in place, and after 5G is in place. Now, speaking to the workflows of public healthcare systems, um, what things do you see going forward as to what a new picture of a place like Africa could look like if the majority of citizens are outside of the cities and they will be covered in this last mile of connectivity? I mean, what could governments look out for there?
That's a really good summary and a very good question, of course, and it's I think that one that troubles a lot of us. So, of course, there's a lot of sparse areas across the globe, particularly Africa and Asia, of course, vast continents, as you've suggested, with the accumulation of people within the cities, because that's where the promise of income, financial rewards are, and jobs ultimately. So, as you move forward, we've got something about rebuilding cities, changing, using this landscape much better. Let's take an example. I am from Bangladesh. If you go to Dhaka, Dhaka has an enormous amount of people in a very small space with very little infrastructure to support them, because that's where the financial hub is. That's where the jobs are. Wouldn't it be sense for these kind of countries at some stage to think, actually, let's drive it differently. Let's build different cities elsewhere where the jobs can be built, rather than the same city over and over again. Use our land in different ways. I'm saying the same for Africa and other parts, of course. So it's saying, let's redistribute that wealth, the economy accordingly, and the healthcare system so it's not overburdened, so people have more equity. And equity is going to be the key word as we go forward. So that's one thing I would say. In terms of connectivity, I think you're absolutely right. We need again to give people the connectivity they deserve. You know, here at the moment, I'm in UK, London. I have a high-speed fiber optic bandwidth that gives me, I don't know, about 500 gigabytes per second or something. Yeah, I have a 5G phone that can download speeds at 1.5 gigabytes per second. Yeah, so but I don't need as much as that, of course. How do we give the connectivity to people more remotely? So it's more equitable. If you want to access healthcare, if you talk about smart cities or remote monitoring or using AI, deep machine learning, as we have at the beginning of the conversation, you need to build the capacity. If you look at the past when people have tried this, you remember Facebook a few years ago used a drone to fly around 30,000 feet or something like that, around to giving connectivity as it flies around, and that was abandoned. Google Loom using balloons to push up connectivity around the atmosphere. And I know during the Haiti crisis, they put some balloons up to give those people connectivity when all the infrastructure was down. So we're seeing companies thinking differently. Now, of course, moving to these Starlink and others, pushing lots of satellites into the air. It was like a race to see how we can get in. And that offers a really good opportunity. If we can get that right, connect people much better, we can then think more exponentially about what the technology we're discussing today can benefit many more people. So it's about equity, it's about access, and it's about affordability. I think these are kind of thought processes going through our minds. How do we connect all these pieces together? It's still not clear. It's obviously still discussion, and this is why we're having this great conversation today about what that could look like, what the barriers, how do we use that information and the expertise, the engineering capability to kind of make that world a fairer place. And so that's the vision that we all have, of course. And I think, you know, both governments, industry partners, healthcare providers, will all be involved in this. The last thing, of course, is the word collaboration. As we point to that future, we can't do it all ourselves. We have to collaborate and make sure that we bring all the right people into the conversation, including our patients, of course, to see how we move forward with this kind of vision that we've been discussing over the last hour or so.
Great stuff. Just in closing from my end, what I'm seeing is that there's going to have to be some type of price controls once these satellites start, providing 5G connectivity to the consumer. I'm just afraid of the monopoly that comes to mind. But certainly, I mean, if we think about the scale of business that these communications companies will be able to achieve, I just hope that they will feel incentivized enough to lower the prices, just so a lot more people can participate in the digital economy, whether remote or urban, and just taking on much more data intensive workloads and workflows. I think there's going to be a lot of efficiencies from that, especially because remote working is becoming a normal across the board. So very interesting times, and I'm just so happy. Very exciting times. Professor Shafi Ahmed, thank you very much for being with us. I really appreciate having you here, and it's just been a very enlightening session. Thank you very much.
Thank you so much.
All right. Bye-bye.